Making an occupied bed. As a home health aide, HHA, providing a clean, safe, and comfortable environment for your client is essential to their well-being. One of the most important daily tasks in home care is making an occupied bed, changing bed linens while the client remains in the bed. This skill promotes client comfort, supports infection control, and protects the client's dignity and safety, especially for those who are bedridden or have limited mobility. In this lesson, you'll learn how to safely and effectively make an occupied bed using proper body mechanics and infection control practices. When and why to make an occupied bed. When it's necessary, the client cannot safely get out of bed, during routine morning or evening care, after episodes of incontinence, perspiration, or spills, to promote cleanliness and comfort. Why it matters: prevents skin irritation and pressure injuries, maintains dignity and comfort, reduces germs and promotes infection control, encourages a clean, organized environment. Supplies and preparation. Supplies needed: clean bottom sheet, fitted or flat, clean top sheet, pillowcases, blanket or bedspread, waterproof pad or bed protector, if needed, disposable gloves for hygiene, laundry hamper or bag, preparation steps. Wash your hands. Explain the procedure to the client to gain cooperation. Gather all supplies before beginning. Check the bed height and lock wheels for safety. Put on gloves if handling soiled linens or bodily fluids. Step by step, making an occupied bed. Position the client safely. Help the client turn onto their side, facing away from you. Ensure the side rail, if available, on the opposite side is raised. Tuck a privacy blanket over the client to maintain dignity. Remove soiled linens, one side at a time. Loosen the bottom linens and roll them inward toward the client's back. Tuck the rolled linens under the client. Avoid shaking linens to reduce the spread of germs. Place clean linens, same side. Place the clean bottom sheet on the exposed mattress. Tuck the corners and sides neatly. Roll the clean sheet toward the client and tuck it under the soiled linens. Reposition the client. Gently roll the client onto their back, then over the hump of clean soiled linens to the other side. Raise the opposite side rail, if available, and move to the other side. Remove and replace linens, second side. Remove the soiled linens and place them directly in the laundry hamper. Pull through and secure the clean linens, tucking in all sides smoothly to avoid wrinkles. Add top sheet and blanket. Ask the client to hold or tuck the top sheet under the blanket while removing the old one. Place the clean blanket and top sheet over the client, then adjust and tuck at the foot of the bed. Change the pillowcase. Gently support the client's head and remove the old case. Insert the pillow into a clean pillowcase without shaking it. Position the pillow comfortably behind the client's head. Infection control and safety tips. Always wash hands before and after the procedure. Wear gloves when handling soiled linens or bodily fluids. Avoid placing dirty linens on the floor or other surfaces. Keep bed wrinkle-free to prevent skin breakdown. Use proper body mechanics. Raise the bed and bend your knees, not your back. Respect the client's privacy and modesty at all times. Documentation and communication. After completing the task, document the time the bed was changed. Note any soiling, skin breakdown, or unusual odors. Report anything concerning to the supervising nurse. Effective documentation ensures continuity of care and early detection of potential problems. This lesson highlighted how occupied bedmaking supports hygiene, comfort, and professional care. Making an occupied bed is a clinical skill, not just a cleaning task. It reflects professionalism, respect, and client attentiveness. Helps prevent skin complications and maintain hygiene. Improves client comfort and satisfaction. Mastery boosts HHA confidence and care quality. A well-made bed promotes client dignity and reflects skilled, attentive caregiving.